Okay, I think we're live. A very warm welcome to you, and thank you for joining us for One Gloucestershire's live broadcast on this beautiful sunny day in Gloucestershire. I hope you're well, and that's really what this is all about today, staying well this winter. My name's Faye Hatcher, and I'm your host for the next 40 minutes. And we have a brilliant panel of healthcare experts lined up for you, and I will introduce them to you in just a moment. The NHS is just about to go into its busiest and most challenging period in the calendar, winter, and against a backdrop of a cost of living crisis. So we'll be finding out today what NHS Gloucestershire and health and care partners have been doing to prepare for this extremely busy time of year. Also, help, advice and support about keeping ourselves healthy this winter, both physically and mentally, and where best to go when you really need help for yourself or the older or younger people in your life. So if you'd like to ask a question today to our panel of experts, please post your comment now. And if you're watching or listening live, and we'll do our best to try and answer your question today. So let me introduce our panel to you, and please give me a wave when I read out your name. I hope you're all well today. You might know her if you live in Berkeley. She might even be your GP, Dr. Alicia Atkinson's GP, Berkeley Place Surgery, and she's an integrated care board member. Give us a wave. And then we have Matt Forrest, consultant practitioner in emergency medicine at Gloucestershire Hospitals NHS Foundation Trust. Thank you, Matt. Hannah Williams, who is Deputy Director of Nursing at Gloucestershire Health and Care NHS Foundation Trust. Dr. Faisal Khan, Deputy Medical Director and Consultant Psychiatrist at Gloucestershire Health and Care NHS Foundation Trust, and Amanda Jones, Director of Operations, Adult Social Care at Gloucestershire County Council. So as you can see, we really do have every department covered today. So Alicia and Matt, if I could come to you both first. Health and care services are already under a great deal of pressure, and to add to the mix, seasonal illness. So what is life like for you on the front line at the moment? What are the key messages you'd like to get across to our viewers and listeners today? Alicia, if we can come to you first.
Sure, thank you, Faye. Well, I think I'd like to just echo what you said, that we need to recognise that we are approaching a very, very busy time, partly because we are already working extremely hard due to existing pressure across the whole of the health and care system, partly because of the rising complexity of our service users, but also due to the rising seasonal illness. What I also would say is I see it in my day-to-day work, I see it in my integrated care board role, that we are working as close as we've never worked this closely before, and we are generally making the best use of the resources. And I think what's bringing us all together is putting the service users at the heart of everything that we do, and this is our sort of common goal that's bringing us all together. Speaking of the pressure on the system, I also would like to make a little plea that whenever you see any health or care professional, whether it might be GP surgery or community hospital or somebody who's coming to your home to care for you, just recognise that we are absolutely doing our very best and working under a great amount of pressure. I think we also need to recognise that for the public, there's so much to think about. It's not just a seasonal illness, but it's generally coping with challenges such as cost of living, the cost of living hitting your home. And we are absolutely working with the public. There will be a lot more practical tips and resources coming out imminently, how to support yourself and your family to stay well during the winter.
Matt, the same question to you then. What is it like on the front line at the moment, and what are the key messages that you'd like to get across to our viewers today?
Yeah, no worries at all. So, as you would expect, and as you probably see all over the different aspects of TV dramas and documentaries that are going, the A&E departments are extremely busy. And we say that every year, and it never lets up. We often face lots of patients coming in, and what we are seeing is patients are getting more and more unwell, and they need our specialist care. So we are continuing to provide our services across the emergency departments. We are really focused on driving forward within the winter plan and working with One Gloucestershire to get this right. But what we are asking is those that are truly an emergency, come and see us. We're open for you to come at Gloucestershire 24 hours a day, and in Cheltenham 8 till 8. And for anybody else, if you think that you might not be an emergency, consider using the 111 telephone or the 111.nhs.net website in order to try and get some advice and see whether you can be seen at other alternative services. So we've got lots of minor injury and illness units that you can access, pharmacies that you can access, and these are really, really valuable resources for you to go ahead and see whether you need those services before you come to A&E.
Perfect. Thank you both for that. Let's bring in the whole panel for this one then. So we're heading towards winter, and as we know, the NHS as a whole is already under a great deal of pressure. However, a raft of measures are being put in place for the coming months. So we are prepared here in Gloucestershire. So could you each talk me through, please, what you've been doing in each of your departments to prepare for this winter? So if we start with Alicia first, please.
Of course. So we have a whole raft of different measures. Some of them are happening as we speak. The winter plan pledges include 4 key things. Matt already mentioned the importance of community pharmacists. Community pharmacists are extremely well qualified, experienced clinicians. So if you phone, for example, GP surgery and you've got a minor condition, for example, a cough or cold or sore throat, or in fact a waterwork infection, we're now promoting community pharmacist consultation service, which means that you will be offered an appointment with the local pharmacist that's really close to your home, and they can often meet your needs just the same way like a GP without having to wait for a GP appointment. The second pledge includes an ongoing campaign for vaccinations. We know the best way to protect yourself against winter coughs and colds is to make sure you get vaccinated. So if you are eligible and you haven't yet had your COVID or flu jab, please get that organised. We are actually going out to you. We're going out to the heart of the communities, particularly in the vulnerable areas, to make sure that people can access the healthcare that they need. Our third pledge is to continue to provide additional appointments in GP surgeries, including on weekday evenings and Saturdays. And we are offering a range of different appointments, including with other healthcare professionals, not just GPs, because actually we know that a lot of healthcare needs could be met by other healthcare professionals. And then the fourth pledge is recognising that seasonal illness often includes respiratory infections. So we are aiming to provide additional 10,000 appointments through to March for people who might otherwise end up in hospital with a chest infection. So what we know is that the respiratory infection hubs, they're already saving unnecessary visits to the hospital, and they're creating extra capacity in primary care. And certainly we're receiving very positive feedback both from the staff and the patients who have used the service. I could also talk to you a little bit more about some other initiatives that we are doing. So things like virtual wards and warm home prescriptions, if you'd like me, Faye.
Yeah, go for it, Alicia. Thank you.
So virtual wards, something that is common, is something that common between me and Matt. It's a joint innovation, which is essentially using technology to enable clinicians to safely monitor people in their homes. So traditionally, Matt might see somebody with a chest infection and say that they need to stay in hospital for that treatment, whereas now we are actually monitoring them safely at home so that they continue to receive the treatment that they need, and that's quite exciting. The second really exciting innovation that we're seeing again this year is a really sort of joined up care between health, NHS, voluntary sector, who came together to address the fuel poverty. And we know that the people who struggle with paying their bills are more likely to be vulnerable, and unfortunately are also more likely to be affected by the cold weather. So together with 7Y Energy, up to 300 people who have cold sensitive conditions such as, for example, asthma or bronchitis, will get support to pay their energy bills, so that they don't need to worry about being cold this winter. There are also some funding available to carry out improvements to houses to make them more energy efficient. And it's not just good for the bills, it's also good for the environment. So I think whatever's good for the climate is usually good for your health. And finally, I just want to finish something that's really close to my heart, because I'm very heavily involved in primary care networks. So primary care networks is a cluster of practices that voluntarily come and work together. And as a result of the primary care networks, we've been able to provide 400 additional professionals across Gloucestershire. The range includes familiar specialties like clinical pharmacists, paramedics, also social prescribers, physiotherapists, and they all work together as a team within general practice. And what I would say is, when you get offered an appointment with one of the healthcare professionals that isn't the GP, they are a fantastic resource. They often will do just as good job or even better job, because they know more about their specialty. And I know we receive daily really positive feedback from my patients who see healthcare professionals that work within our primary care network.
Great, thank you for that, Alicia. I'm going to ask the question again, just for the benefit of anybody joining us now during this discussion. So, Matt, I'm going to come to you next. So, what has your department been doing to prepare for this winter?
So our emergency department and all of our hospital networks have been working really hard on our winter plan. And we always talk about the winter plan, but it is really the foundations to how we survive winter. It's how we step up and how we respond to our increased demand against acute infections, but also, as we've already alluded to, the social aspects that surround a winter period. So it's really important that we acknowledge that the work that goes into this is really big, and everybody really starts to step up and takes in more than what we normally do as business as usual. So within the emergency departments at Gloucester, we are in the process of opening up one of our new emergency department expansions. So that will be in a few weeks to come. And that will offer a little bit more capacity and a nicer environment for people that do come in with emergency care needs, a nicer environment to go and be seen in. And that's really important and really nice that we have that coming forward. And that's been a big project that's been going on for a few years now. What we will be doing is looking at utilising what we call our same-day emergency care, and it's often referred to as SDEC. We love our acronyms in the NHS, but we use it as SDEC, and we're expanding that not only across medicine, but we are looking at how that can go through into the surgical divisions as well. And what that does is allow patients who need emergency care at the same time but don't need A&E, and they get seen by the specialty directly. And then they go on to all these virtual wards and they get continued investigations and treatment. What that allows us to do is get those patients that do need the A&E department, and those patients are on ambulances, to be offloaded lots quicker. And that's really exciting to see that expansion of that same day emergency care driving forward through Gloucestershire. If we have patients that come in with things like respiratory illness or frailty or mental health conditions, we're getting the right people to see them right first time. So we've got a frailty team that's coming into the emergency care department and dealing with these people and addressing all the holistic needs that they have. And also, really importantly, when people do come with mental health conditions, we have all the abilities to put them on virtual wards and we get to see them immediately. And that's something that within the emergency department we're really, really proud of. But also that's been working with One Gloucestershire and the teams about providing a mental health service in the emergency department, so any patient can walk in. On average, they get seen within around 45 minutes of arrival. The service runs 7 till 7 each day, but we really are passionate about getting this to be increased to 24-hour service. And what we have seen is such a positive feedback, and it has been so rewarding to hear the feedback that's coming from this. And we're actually there's only 3 of these schemes out in the whole of the NHS, and we're really proud to hold that within Gloucestershire. So that's a really positive thing that we've seen this winter continue through. For people that come in with their emergency care needs, they will be seen by doctors and practitioners nurses and therapists, and we're working together as a multidisciplinary team. And that team approach is really key within emergency care. We really do hit you with lots of people who are experts in their field to come in and see what we can do for you. And that may well be that we just get some early diagnostics and testing. It may well be that we put you on a virtual ward and continue your care in the community, or we refer to our community services. Whichever way we do that, and if we are supporting you in a discharge, we will do so 7 days a week if you're fit to go, and we will put everything in 7 days a week. So making sure that medication's given to you early, that you get home in daylight hours where possible, and accepting that also with hand in hand with our colleagues in the community and social care, that we've got the most appropriate place for you to recover. We know that hospitals aren't the best place for people to recover nowadays. So it's about making sure that you're in your own home, or you're in your care home, or you're with your family at the right time of winter, recovering and having all the support and access for health needs. So that's our winter response.
Brilliant. Thank you very much, Matt, and thanks for explaining the acronym as well. Okay, let's move to Hannah Williams next. And Hannah, I'm going to ask you the question again. So in community services, how and what have you been doing to prepare for this winter?
Yeah, thanks, Faye, and hi, everybody. So just like our colleagues in GP surgeries and at the hospitals, we've been planning for this throughout the summer, as we do every year. And alongside everybody else across Gloucestershire, we're really confident that we're in a good position as we head into winter. So we've also identified some pledges that we will focus on as an NHS trust. And they really are all about supporting people to stay at home as far as possible. We know that hospitals are amazing places, but only for certain things, for certain people. And actually, a lot of people get better a lot quicker if they can have all that amazing expert care in their own home. And that's kind of really what we as a trust are all about. So we focus on both supporting people to stay at home rather than go to one of our big hospitals, but also we support people who've perhaps got an existing health condition that might be asthma or arthritis, to really prevent that condition becoming worse in winter months, as we know that the cold weather particularly can make people with those existing conditions feel really quite poorly. We do a lot of work with South West Ambulance Service with regards to helping them when they turn up to somebody's house or to a care home, to really explore whether that person does need to go to the emergency department. Is there one of our services that we can step in fairly quickly to support that individual? You've already heard Matt talk about our frailty team that we work with partners from Gloucestershire Hospitals Trust on, but we also have been developing our virtual wards as well. And again, that's absolutely because most people want to be in their own home when they're feeling poorly, and we're able to support them to do that. So in terms of how have we been preparing to make sure we can deliver that, we've been doing the planning for a long time. The planning doesn't happen in isolation. So working in the community, a lot of our work is with Amanda's colleagues in social care. We couldn't do anything without our colleagues in social care. So we talk to them a lot. We do a lot of joint planning in order to make sure we get things right. One of the other key things is really important that I make sure all of our staff are as fit and well as possible so that they can look after everybody. Two big things to make that happen is to make sure that all of my staff who want either a flu jab or a COVID jab can have one, because that will hopefully stop them getting poorly. We are able to commit to having our existing rapid response service. So that's a team of very, very skilled nurses and paramedics who provide those advanced clinical things in your own home. We've been able to say that we will provide that service within a 2-hour referral window this winter. So again, much better for the person, better for their family, who are often waiting with them and feeling understandably anxious. We've also increased the number of staff that we have in our Home First service. So Home First is something that we can provide to somebody who is leaving hospital but needs a little bit more time and support to get back to being as independent as they were before going into hospital. But it's also something that we can put in to stop you going into hospital. So you might need a bit of help from our rapid response nurses or our district nurses to manage your medical condition, but then you might need some help from our Home First staff to help you be able to make yourself some tea again, make sure that you can get up and down the stairs feeling safe. So we're doing an awful lot, just like everybody else in Gloucestershire, but our world really is about supporting you and your families and your friends so that you can, as far as possible, stay at home and have that expert clinical care in a place where you feel safe and comfortable.
Great. Thank you very much for that, Hannah. Let's stay with community services then, and let's hear from Faisal now. And you work in mental health services. So Faisal, once again, what have you been doing in your department to prepare for this winter, please?
Thank you, Faye. My colleague Hannah has, to an extent, covered the physical health side of things, but from a mental health perspective, speaking of parity of esteem, mental health does not take any breaks in winter time or any time of the year. The need is there at all times, particularly around winter time, with shorter days, with isolation, with more added physical health ailments. People with existing mental health conditions can have a negative impact where additional support is absolutely necessary in such circumstances. We are aiming to provide community mental health support as much as possible to try and avoid hospital admissions, particularly looking at Christmas time when people want to be near family, with support around family, and to also aim to provide more availability of psychiatric hospital beds when needed for the very acutely ill, which has been a challenge nationally for some time. But our planning is to ensure that all patients in hospital that can be treated at home in their own environment with additional support, that we focus on that. We are also aiming to improve our resilience in providing support in the community, i.e. Just like the public, our health professionals fall ill. We've had COVID illnesses, we've had other illnesses, which has meant that we've not been staffed well enough to at times address all needs. However, we have backup strategies. We have strategies in place where should we face a situation where we have illnesses, that we have staff available to fill those gaps and keep services going. From our point of view, crisis services are there 24 hours a day, 7 days a week, and for people who need it at any time of the day. We being referred to the contact center, but some people do need to go to the emergency department to ensure that the liaison service is there available for them to be seen in a timely manner, and then for crisis intervention, if that is what is seen as the next step possible, reducing the amount of time one stays in hospital, even in the acute hospital, as much as possible. So it is more about improving our own resilience, at the same time acknowledging that the need in the wintertime can increase. And there are many factors that play a part. As I said earlier, physical health issues, shorter days, isolation, and again, in terms of cost of living, even for people who can't go out, get food and other essentials, that we can help and support them with it if they struggle to do so. So the aim is to provide a service that's there 24 hours a day, 7 days a week, and if need be, work very closely with our acute colleagues should they present at A&E, and how we can intervene and try and reduce the time that they spend in hospital as much as possible.
Thank you for that. Thank you for that, Faisal, and really reassuring to hear that this service and support is there 24 hours a day and all throughout the year, not just around winter time. Finally, let's cross to Amanda Jones then. And Amanda, you work in social care, so the same question to you again. So what have you been doing in your department to prepare for this winter, please?
Yes, thank you, Faye, and hello to everybody. So in adult social care, we've been working as part of One Gloucestershire on the winter plan that colleagues have mentioned earlier, and our winter pledges illustrate our commitment at Gloucestershire County Council to work with our health, community and voluntary sector partners. So in terms of what we're doing to support, we've got additional social care workers in our accident and emergency departments, working alongside health staff to support people and, where appropriate, help them to return home with appropriate support and care to try and avoid that admission. We offer advice and support to community services at that front door so that we can see what appropriate support might be available for that individual. And we also work with their families and carers in that space. We also have a dedicated hospital discharge and assessment team that work alongside our health colleagues. So they work in various locations in the county, including the local hospitals, Charlton Lane Mental Health Hospital, and our assessment beds across the county. So our social care team work alongside all of the other people in that space as part of the One Gloucestershire approach to support people and facilitate discharge from hospital when people have been admitted. Also, as a system, we work really closely with our voluntary and community sector who are supporting people to settle in at home after they've left hospital. So organisations like Age UK, Gloucestershire and the British Red Cross will phone people to check in once they're being discharged to ensure they have everything that they need to remain well at home. So that might be something like helping them to access equipment or services, or arranging for shopping or meals to be delivered. We also have some care navigators who provide support and information when people are admitted to hospital. And our care navigators work alongside teams such as the Complex Care at Home team, the North Cotswolds Frailty team, and our community hospitals across the county. So the intention of the work that they undertake is to prevent avoidable admissions, and also where people have been admitted, supporting them to get home from hospital. So this is a dedicated approach to ensure people are cared for in the best place to meet their needs as soon as possible. In terms of the wider adult social care offer, we have our social care and support service teams that work collaboratively with people to identify a plan of support where needed. And this isn't just around hospital discharge. Indeed, most of our work happens in the community. We work with people in their locality to find solutions for them to stay as independent as possible. And in order to do this, we may help them to identify a short-term offer of support to get them back on their feet, working alongside their carers and their networks, again, to try and keep them at home. And for people who may need a plan for more long-term care and support, we work with partners and providers to offer the highest quality of support that we can, and we keep in regular contact with those people. We have an adult social care help desk that is there for people to access, and they can call us to get advice. We also have an advice line around our funding and charging processes. So we are working really closely with all our partners and continue to extend that offer and really focusing in on what we need to do for this winter.
Amanda, thank you very much for that. Finally, I want to sort of focus on what we can do ourselves, as in the general public, to keep ourselves well. And it might be useful to hear from Alicia and Matt again on this. So Matt, from an A&E perspective, you don't necessarily want people coming to you if it's not really an emergency. So it's all about seeking the right sort of help for your need.
Yeah, definitely. And that starts from the home, in the car. You know, majority of people nowadays don't have things like first aid kits, which is really key to have in your winter plan of your own health. And stock up on things like paracetamol and that type of stuff that you may need just to see you through a temperature when you have things like flu or sadly the COVID. Definitely take up your vaccines if you're eligible to do so. And if you need advice, just, you've got the 111 website, you've got the One Gloucestershire ASAP app that you can go on to and get all the help and advice that you need in order to try and stay well this winter. And above everything, I think utilize the people that are around you, stay close with family and friends. I'm sat in my conservatory today because I need some sunlight. And it's just about being really positive in your mental health as well as your physical health as well.
That's great. Thank you very much, Matt. Alicia, there's not only lots of things we can do to look after ourselves, but also I'm thinking, people with families, young families, older members of their family, the wider community. There is help and support out there, but what practical things can we all do to help ourselves?
Yes, absolutely, Faye. And, let's not forget, most people will get through the winter without having to access the NHS service. So there are lots of things you can do to stay well yourself, and also look after your family, neighbours and friends. There will be a lot of tips and resources covered in a Stay Well This Winter campaign. I mean, some of the things I can give you examples that worked really well last year and going to carry on this year. So what last year we recognised that actually cost of living was really impacting on people's ability to look after themselves. So there've been support available to community hubs to make them into warm spaces where people could get not just the physical warmth, but actually get together with their neighbours, people from their local community to reduce loneliness. We know loneliness is really not good for your health, not just physical, but also mental health. There's also plenty of support available, how you can get some support with the energy bills, and also top tips on healthy eating and staying active. One of the things that we always tell to our patients is, don't forget the 5 a day. Don't forget making a few extra steps each day, because it helps your physical health and massively helps your mental health. I'm not thinking about going to the gym, for example. I'm thinking about reaching out to your local walking group, for example, or joining a community club that might just give you that extra momentum during the dark hours of the winter to get out and do something active. The other thing that Matt already mentioned is getting vaccinated. I can't emphasize how important it is, and I will making it as easy as possible for people to get vaccinated close to their home.
Great, thank you very much, both. And I want to open that question up to the rest of the panel if there's anything else you want to add. So what practical things can we do to help ourselves during the winter time? Has anybody else got anything to add? Faisal?
I think planning is essential. I think my colleagues here, Matt and Alicia, have already addressed that. Individuals with mental health needs who are under secondary health services, for example, they can have a conversation with the care coordinator and put some plans in place should things get difficult in the winter time, that there's a strategy in place that could be picked up by the care coordinator should the individual struggle to ask for help at that point in time. Things to look out for should things get difficult. And that, I think, makes it a lot easier to plan for should things get really difficult for everyone. Secondly, if you are not under secondary mental health services, having a conversation with family members, loved ones, just to see if things get difficult for me, who to contact, how to contact them, and who to approach should that need arise. And with a service that is available 24 hours a day, 7 days a week, it might take a little while to call back. The contact center might take a little while to get it through to the right services, but you will get a call back. You will be contacted. And I think as long as that information is shared, that information is available, it'll make it so much easier to ask for help when the time comes, and for us to then approach and take the first step if it's really difficult for you to take that first step. So I would say advanced planning, having a strategy in place should the need arise. Thank you.
That's great. Thank you, Faisal. Would anybody like to add anything else? Okay, I know we're all. Oh, sorry. Yeah.
No, thank you. It's just a quick one, really, because there's an awful lot of really good organisations and activities helping in the community already. You know, we've got a really active community base here in Gloucestershire, and I think it'd be really good if people just took a moment to have a look at what was happening in their local area and stay connected with that and make the best out of what's on offer.
That's fantastic. Thank you very much for that. I know we're all busy, and I know everybody's got to go back to work in a few minutes' time. We've got time for just a very quick Q&A, and I want to ask this question purely from a selfish point of view. I actually went to an NHS dental appointment this week, and ongoing sort of wisdom teeth issues. But if anybody is needing urgent dental support and treatment over Christmas, over the winter time, what's the best thing to do? Who would like to ask that question?
I can take that question, Faye. So what I would say that if you got a dental emergency, you will absolutely get treated. So the first thing to do, if you have got a dentist you registered with, please try to contact them first. Some dental surgeries will have appointments available at short notice. If you do not have a dentist, then please still use the first principle of call first. So go to the NHS 111 and they will be able to direct you to the nearest emergency dental centre. Now, also, I think it's worth acknowledging that access to dentistry is a number one priority for the Gloucestershire NHS. We recognise it's been an issue for some time, and there's been a huge amount of effort going into setting up a dental strategy group, which includes a really wide representation from different stakeholders, including patient representation, Health Watch, and I know we are actively working on longer term solution to make sure that we are attracting the best dentists into Gloucestershire and they're wanting to stay and offer additional appointments.
Thank you very much for answering that question, Alicia. Well, it just remains for me to thank all of our panelists giving up your time today. Thank you so much. And I say this on behalf of all of Gloucestershire, that we're very grateful for all that you do and the spectacular work that you do in our communities. Thank you very much to you for tuning in today. I hope you found it interesting and informative. And if you'd like to listen or watch back to this broadcast, you can do so on the NHS Gloucestershire Facebook page. Thank you very much for joining us. Goodbye and have a lovely afternoon.